OTCs, as all of you must be aware, are over-the-counter medications. These are medications that are usually deemed safe enough to be used for day-to-day ailments that plagues us, like colds, coughs, pains of different kind, allergies, vomiting, diarrheas, to name a few. OTCs are important because they reduce the burden of healthcare, as well as it makes sure that patients are not inconvenienced by needing to visit a clinic or a hospital for a prescription. They are in general safe to use, but the caveat is that they need to be used in the right dose, for the right indication, and for the appropriate period of time. However, even OTC medicines can cause serious harm if you probably take it in too much of a dose, or if you're going to take it for too long. Also, it's very easily possible for you to inadvertently double dose yourself using medications like paracetamol or anti-allergic medications, because these are commonly prescribed, they're commonly present in most of the cold and flu medications that we get. When most people get a cold, they go to the pharmacy and pick up a cold and flu medication, and on top of it, they take paracetamol and add some anti-allergic medications, in the belief that all these medications taken together might help you to cut short the duration of illness. But on the other hand, it just increases the risk of side effects with the OTCs. Also, OTCs you can be allergic to OTCs, and they can cause allergic reactions to them. And also the OTCs can have interaction with various food, alcohol, or caffeinated beverages that you're going to take these OTCs along with. Please remember that herbal medications and alternative medications also come under the category of OTCs, and if you're going to take those along with the usually dispensed OTCs, then that can also lead to interactions and harm. And in those who are already taking prescription medications, in them it's a tricky thing when to use OTC medications, especially if the prescription medications are generally, like for example, if people are using blood thinners, and those who are using blood thinners, if they need to take, for example, painkillers, and if they go ahead and take ibuprofen if you've not taken previously, it is possible that, at least theoretically, that they can cause serious bleeding from the stomach, and that can be sometimes potentially fatal. So it's important for people on prescription medications to check if their OTC medications are safe to use along with prescription medications, which you can inquire from your pharmacist, or you might have to inquire with the doctor to find out if this is okay to take. There's also the risk of addiction to OTCs, as the commonest example is a very popular nasal spray, which in this part of the region, many people are addicted to this particular nasal spray, while it's actually not supposed to be used for more than 3 to 5 days at a stretch. And so is the practice with many cough syrups. People are actually addicted to many cough syrups, and some of them use them to even get on a high. So in this part of the world, at least, since most of these medications, commonly present medications, come under the category of restricted medications, so that doesn't happen here, but cough syrups can be abused very easily. OTCs generally also have some side effects which people need to be aware of before taking the medications, and before they actually want to see if these side effects are worth taking it for the symptoms that they have. A very common example is some cold and cough medications can cause drowsiness, especially if taken at a higher dose. And in certain category of individuals, these same cold and cough medications can cause them to lose their sleep. They could remain awake throughout the night. So it's very paradoxical. The same cold and cough and cold medication, cold and flu medication, can cause the opposite effect. And these cough and cold medications also can cause hyperactivity in the younger age groups. So hence, while OTC medications again are generally useful medications, it's not all rosy picture with OTCs. So one needs to, so if one falls ill, it's very important for them to be prudent and wait and watch for a few days, and use some of the time-tested OTCs like paracetamol. Probably if you have a cold and cough, drink lots of fluids, and wait and watch and depend on the body's healing power. Trust sometimes the healing power more than the medications, and see if things settle down. But if it doesn't, then a visit to the hospital or the clinic it probably is in order. Self-diagnosis at the end is always dangerous, and so is Dr. Google or any other AI-based diagnosis.